The Global Prevention Coalition puts Ghana in the category of countries that are staying. And it hit me so hard because I always want to stay where I'm comfortable. And in this particular case, it is not a comfort zone. So Ghana is rather standing in readiness to run. Good morning, ladies and gentlemen. Co-chairs of this conference, our dear First Lady, Rebecca Akufo-Addo, Minister of Health, Honorable Kwaku Agyeman-Manu, Director of Public Health of Ghana Health Service, Dr. Sarkodie, our international participants, ladies and gentlemen. I want to associate myself with the minister's welcome and welcome all of you, especially our international partners. And this morning, I want to give you a special treat by presenting the 2018 data of Ghana, which UNAIDS will release in June. So by being first to know also means you are welcome to come back to visit Ghana as often as possible. I'm presenting on the status of HIV in Ghana. And as you all may know, Ghana is a lower income country with an estimated population of 29.5 million. We describe our epidemic as a generalized one, with pockets of high prevalence in some geographical areas. And of course, HIV prevalence in key populations are much higher than that of the general population. So for the adult population, HIV prevalence is about 1.7%. That of female sex workers is 7%. And that of MSM, men who have sex with men, is 18.1%. The total HIV population as at the end of 2018 was 334,713. New infections were 19,931, and AIDS deaths were 14,181. This slide shows new infections, showing that this is the total new infections. It's remained quite high for the last 9 years, and it's been around 20,000 or more. The trends for the other age groups, this is the adult age group 15 to 49. The red one is 15 young people, 15 to 24, and children is the blue one, 0 to 14. As you can see, they are all not showing signs of decline. Annual deaths also show similar trends and not showing signs of decline. This particular slide is important for the obvious reasons. I'm right-handed, so I better use my right hand. Yes, the blue line represents the new infections, and the red line AIDS-related deaths. For us to achieve epidemic control, both new infections and AIDS-related deaths must fall rapidly. And in fact, the new infections must fall below the AIDS deaths. But the way these lines are behaving suggests that we have quite a way to go as a country if we must achieve epidemic control. This slide is being presented for two reasons. One, to show that yes, as a country, we have always ensured that the last mile is first. But still, the general population is very, very important when it comes to new infections. In 2014, heterosexual people involved in casual and heterosexual sex contributed more than 72% of new infections. And that was 58.9% in 2009. But look at that of men who have sex with men. In 2014, 5.4% contribution to new infections, but whereas it was 7.9% in 2009. That is 4 years earlier. Sorry, how many years? 5 years earlier. For female sex workers, 2014, 18.5%, but in 2009, 31.1%. What does that tell us? The storyline is that since 2004, Ghana has made sustained investments in HIV prevention among key affected populations. But this has not been the case for the general population. Since 2010, when Ghana ran out with the World Bank credit, we haven't made significant investment in prevention among the general population. And that seems to sustain the high level of new infections. So the fact is, sustained investment in prevention will certainly lead to reduction in new infections. Our response is just about the same as almost every country that is represented here. It is guided by a 5-year strategic plan, and the current one is for 2016 to 2020, with the goals of eliminating AIDS by the year 2030 and achieving the 1990 targets by 2020, in line with the Sustainable Development Goals. The impact results that we want to achieve by implementing this strategic plan includes the fact that we commit to reducing new infections by 80% and AIDS deaths by also 80%. So where are we with the 1990 targets? The 2018 data shows that by the end of 2018, 55.3% of persons living with HIV were diagnosed and became aware of their serostatus. 33.8% of people knowing their status were put on antiretroviral treatment, and 22.5% had viral suppression. In terms of numbers, is of the 334,000, 184,955 were diagnosed. 113,171 were put on antiretrovirals, and viral suppression occurred among 75,172 people. So, how do we proceed? We continue to commit to achieving the 1990 targets. And therefore, our approach must be direct, it must be strategic, and it must be focused. For me, it must be deliberate, intentional, because there is nothing new under the sun. We know what works, and we have to make what works work for Ghana. And so we are using standard models of care, differentiated delivery, service delivery models, which should help us to test and link people who test positive to care, support them to remain in care and adhere to treatment, and ensure that we give them the necessary clinical care so that we can see more and more of them having viral suppression. And the key things, actions we need to take for HIV testing services and linkage, I think it is possible for Ghana to initiate 90% of people who test positive onto antiretroviral treatment in the same day, and if it should wait, it should not exceed 10 days. And this is possible to do. We also would have to ensure that at least 85% of newly enrolled clients on antiretroviral treatment are retained. 90% on those currently on treatment can also be retained in care if we continue to do active monitoring, having all facilities doing weekly reviews and active tracking of those who are lost to follow up. Multi-month scripting is very important, and that is what all countries that are achieving the 1990 targets are doing. And so we have agreed to make it possible for stable patients to receive the refill in 3 or 6 months. It is also possible for us to also have 90% or more viral suppression. And if we do the right things, making sure that they adhere to treatment, and between 6 and 12 months, we should see most of them being virally suppressed. Some of the intentional actions that we need to take will have to be focused. For the first 90, we keep talking about index testing. Family approach must be used. And also make sure that partner notification is encouraged at all times. We have to find people who are at risk and possibly having HIV wherever they are. And so we have to use population location strategies in identifying these people. We already have a policy for provider-initiated testing, especially among OPD clients. And this should be pushed as hard as possible so that more and more people who go to hospital can be tested, because the yield among hospital clients is always very high than what we get in the during community or outreach testing. Ghana's Commission has taken a policy decision to introduce self-testing, and as soon as we are done with the paperwork this year, self-testing will start in Ghana. For the second 90, we need to take new measures, and we have to go to the original plan. In the Global Fund, plan, the proposal we submitted to Global Fund, we said that we are going to expand antiretroviral treatment to 400 ANC sites, because these sites cover about 80 to 90% of pregnant women. And we know that 65% of people living with HIV in Ghana is women, and 62% of new infections occur in women. So making the treatment program, having it around women, will give us greater success. And so these are the things we will have to do. As we have said, we cannot treat ourselves out of the epidemic, and therefore prevention is also very, very important actions that we need to take. And in prevention, we are looking at combination prevention for key populations, for adolescents and youth, women, and some men who should be targeted. Again, we are introducing pre-exposure prophylaxis in Ghana this year. The third 90, these are the things we will do. In conclusion, I want to say that we have the right policies and programs in place. We just have to implement, because policy in action can be costly when it comes to HIV. So we will use all the pragmatic measures to reduce new infections and AIDS deaths, and also rapidly increase coverage for all the services that we provide. We strengthen monitoring and evaluation to ensure that we have quality data, and we need stronger collaboration to achieve our goal. Thank you very much.